Hello, Partnering for Vaccine Equity learning community members and others working on vaccine equity, and welcome to this afternoon's learning event. My name is Luis Gallardo, the website manager for the learning community, and on behalf of our group learning team at the Urban Institute, thank you for joining us. This is the fifth event in our Social Determinants of Health series, and today we will hear about how immigration enforcement is deeply harmful to the health of immigrants, their families, and their communities. In this talk, we'll reflect on the mechanisms by which immigration enforcement can make you sick and what we can do about it. Before we go any further, I'll do our typical review of how this session will work. Next slide. You've all been muted upon entry to the session. There are a lot of us, so staying on mute unless you're speaking is key to keeping the discussion going without accidental interruption. You do have the opportunity to speak your question rather than type it. If you want to speak your question, use the raise hand feature and we'll unmute you. If you want to type your question, use the chat feature. We also encourage you to chat amongst yourselves as you'd like, but please use good chat room etiquette. And though this probably goes without saying, please be civil to one another and to our speaker while chatting. We do offer live interpretation from English to Spanish during our event. If you would like to listen to the Spanish language channel, simply click on the globe icon in the Zoom taskbar at the bottom of your screen. Finally, as with all our learning events, we will post the slides and a recording of this event on our community website and circulate them through the digests that go out through the CDC-managed Adult Vax Program listserv, which all program members should be a part of. If you have technical difficulties at any point during this session, please send an email to our community manager's inbox, vaxequitylearning@urban.org. We'll be watching the inbox and we'll try to help you as quickly as we can. And now it's my pleasure to introduce our featured speaker. Dr. William Lopez is a clinical assistant professor at the University of Michigan School of Public Health and the author of the book, Separated: Family and Community in the Aftermath of an Immigration Raid. A proud San Antonian, William received his undergraduate degree from the University of Notre Dame before returning to Houston for his master's in public health. William teaches about the impacts of immigration enforcement and police violence on individuals, families, and communities, and has collaborated extensively with community organizations to make his county a safer, more just place for those of all immigration statuses. He lives in Ann Arbor with his partner, 2 children, and a pandemic pup. Thank you, Dr. Lopez, for taking the time to speak with us this afternoon. I'll hand things off to you now.
Thank you so much, Luis. And just to confirm, you can hear me and see me okay? Great. Great. It's great to see so many people today, 39, and the number keeps climbing. As the bio mentioned, my name is Dr. William Lopez. I go by Bill. I'm faculty in the School of Public Health and live here in Ann Arbor, originally from Texas. I want to talk to you a little bit today about how immigration enforcement makes us sick or can make us sick. And I want to do so by thinking about what we call in public health and what many of you know as the social determinants of health, right? And this is a way that I'll show you shortly in which we can think about all of the factors in our lives that shape the things we do individually that can help us or harm us, right? Can help our health or harm our health. It's really important to think about how some communities experience different social determinants of health than others. Before I do that, I do want to thank Luis for his patience with me. Luis and his team have been nothing but patient and professional in welcoming me to this space. And yesterday, when Luis reminded me to send the slides, I said, "Oh, I'm sorry. I thought this was the panel presentation." And he graciously reminded me, "No, we met. No, we talked about this. No, it was a presentation." And he was right. I was looking ahead on my calendar and not to this one. I'm very happy to share the slides, but I did want to thank you, Luis, for, I'm sure I caught you off guard. So I appreciate you walking me back to reminding me what I had committed to today. I teach social determinants of health in School of Public Health. I teach residentially and online. So I'm very happy to also look through the chat while I'm going and when I can answer questions. I'll also at times ask questions of you, which you can respond to in the chat. So today I want to think about a few definitions of health, just to help us think about how we talk and think about health. Not all of you are necessarily in the health field or maybe in public health itself, but to some extent, health is all around us, right? People make decisions about what they believe to be healthy for them. I want you to consider a wide range of factors that shape health. And I want to talk to you about, I want you to be able to define how immigration enforcement and be able to discuss how define immigration enforcement and discuss how it can shape health. Lastly, I want to consider how immigration enforcement can influence vaccine equity, right? Again, I want to use thinking about immigration and deportation as a way to help us think about all of the factors, especially political factors, that shape the lives of those in our community and may influence their behavior around accessing vaccines. So, all right, when I say health, what do you usually think of? Go ahead and put it in the chat. This is what we call a chat waterfall in class. Everyone who thinks of anything, whatever comes to mind, feel free to put it in the chat. When I say health, what do you think of? Wellness, well-being. Thank you, Nancy. Thank you, Eileen. Thank you, Lori. Wellness and illness. The World Health Organization, Lizzie, great. Safety and wellness for everyone. Access to services. Okay, Rudy, physical, mental, and behavioral, overall well-being, mental wellness, great. So already seeing a couple of combinations and so World Health Organization, so we see a structure influencing health, wellness. Great, thank you, Donna. Thank you, Gina. What do you think of when I say health to a non-health oriented public? Just the general public, people who aren't clinicians, aren't in public health. When I say health, what do you think they think of? Lizzie's saying not the mere absence of disease. Lizzie's getting ahead for what I'll show in my next slide. Lori, exactly, not sick. Diet, physical wellness, okay. So when we ask Google, what does Google think? And we ask for images, this is what we see. Well, you see a lot of the themes that are coming up here, right? Not sick. We see physical. We see a lot of diet. We see a lot of exercise, medicine, hospitals. We see a lot of individual decision-making and individually provided healthcare, which is what a lot of you were alluding to, right? Now, these are all important and critical parts of our healthcare system and how we keep our communities healthy. But not everybody's able to make these decisions and engage in these behaviors in the same way, right? There's lots of factors shaping whether we can engage in individual health behaviors or access individual healthcare. So it was Lizzie who, I think, were you actually quoting the World Health Organization? I believe that was Lizzie, and was it this? Yes, I believe you were. So Robert Wood Johnson tells us health means physical and mental. It's health status, and it's distinguished from healthcare. So it's not just our system, our bodies and our minds. And the World Health Organization says that health is a state of physical, mental, and social well-being, and not just the absence of disease and infirmity. It's the enjoyment of the highest attainable standards of health, of health. The enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being without distinction of race, religion, political belief, economic, or social condition, right? So this is the definition of health we pursue in public health, which I have no doubt many of you are pursuing in your own work as clinicians and as advocates working toward vaccine equity or perhaps immigration equality. All right, so what does it mean? How do we create this world and this system in which everyone has the ability to access what they need to stay healthy and to thrive and not simply avoid illness? So McGinnis and colleagues describe causes of premature death as 10% healthcare, 20% environment, 20% biology, and 50% lifestyle. Lifestyle is a little bit of an unfortunate choice of words that makes it sound like risk behaviors like hang gliding and motorcycle riding, but lifestyle really means how we engage in the world around us, right? So we spend these millions of dollars in what Andrea calls our exhausting healthcare system, but most of our health outcomes are influenced by how we're interacting with our world, right? The vast majority of them. And when we consider this, we consider what factors shape our lives, right? It's how we get from one place to another. It's who we associate with, how we get to one place to another, meaning driving, walking, moving about our community, having friends and family nearby, knowing where to go for food and resources. The next step then is what are the factors that allow us or prevent us from doing this? So we call this in public health, and I'm just about done with this social determinants of health part of the series. We call these the social determinants of health, right? The clusters of things in our lives that shape our environment. And we see from Healthy People 2020 that health starts in our homes, schools, workplaces, neighborhoods. and communities. I'll give you a second to read the rest of the definition, but I really appreciate the short and concise definition that we get as well. The CDC tells us social determinants of health are conditions where people live, learn, work, and play. This is what we believe in public health, and this is what many of us, even if we don't use this phrase, social determinants of health, this is how we're moving about in our world, and this is how we're working toward equity for folks. We're thinking about how where they live, work, and play, shaping whether or not they can go to the clinic or get a vaccine or receive health care, right? And these factors of where you live, work, and play are shaped more so for some by policy than for others. And that's what I want to talk about just a bit today. Let's switch a little bit to thinking about removal from the United States, right? So thinking about how deportations in the United States have climbed from 1892 until this chart ends in 2012, but have continued to climb with a steady upward trend or leveling out at these high numbers. We can take a few things from this chart, and one is it's a lot of deportations. It's a lot of removals from our community, almost 500,000 in a year, in years as recent as 2012. And we do know that for every person removed, there's individuals attached to that person, blood and chosen family, and certainly communities. And we know from our work in public health, but also from being people, that when someone is removed, it's harmful to our health. It takes apart our social service network. But it's not just the removal that matters, right? It's not just the taking out of the person. In itself, that is important, but it also matters how we do it. And what we've seen recently, especially in the Trump era, and to some extent in the Biden era, though I would say this certainly happened more in the previous administration, immigration enforcement was increasingly militaristic. I did my work, my doctoral work, and wrote the book Separated, based on an immigration home raid that happened 7 miles from where I sit right now, 7 miles from where Dr. Brown and I got our PhDs, right? This is in our own Midwest community. And I spoke with members of members of a community and a family who lived in a home that was raided by the police and ICE. I welcome you to read more about the situation, but from what we gather both from this work and from research, you can see how traumatic these type of events are, right? This is only one example of one of the tactics that's used to arrest and remove people. So the removal itself is important, as is all the other psychological and physical weight of the interaction with those who are removing you. Our current work looks from, we moved from immigration home raids to immigration worksite raids. So briefly, immigration worksite raids are humanitarian disasters as they were described in 2008 after the raid in Postville, Iowa. They were such disasters that following that President Bush stopped using these raids, Obama neglected them or did not engage in this strategy at all. And then President Trump brought them back precisely because of this disaster that they caused. It became the spectacle of the arrest of, as you can see in the drawing, of immigrants of color being walked away often in zip ties, right? And we studied, in our work, we studied the 6 largest immigration worksite raids that happened in what we call the heartlands of the US. And from Texas, as I mentioned, and I certainly appreciate, and it merits attention of the immigration enforcement that happens along our border, our southern border, especially child separation. But we often miss the immigration enforcement that happens in our own communities in the Midwest and beyond. This often looks like worksite raids where small Latino communities are isolated politically and from just the sheer number of people to be able to advocate. And I'll mention where these drawings came from at the end as well. So what happens when there's this possibility of arrest and deportation? As I described after looking at the home raid that happened in 2013, most of the book was about the details of that raid. But the question I primarily posed to you all is the raid is only one day, right? It's one day of the year. There's 364 other days in which individuals think about the possibility of that raid, right? And that is not to say that every Latino community like mine or every mixed status or undocumented community is only thinking about deportation, right? We have rich and engaging and creative lives. The possibility of removal is that specter that can shape what we do. So I want you to think about 3 pathways in which immigration enforcement can make someone sick. So the first is actual detention and deportation, right? What happens when you're detained? And what happens to the people who now have a member of their family detained? The second is the possibility of deportation. So not that one day, but the other 364. What do you do when you're worried about that possibility? And the third is the threat of deportation and how it can result in behavioral changes, doing things differently, changing the way you do things and move about your world to avoid the possibility of deportation. So let's talk about the first pathway. So for those detained and deported, one thing we know is that detention centers, like many of our US prisons and jails, are not made for human beings to thrive, right? That purpose is not the center of building an incarceration facility. It's something we need to reckon with as public health professionals. Putting human beings in a cage goes without saying is not beneficial to their health. Incarcerating and detaining someone is not beneficial to those members of our community. And detention spaces themselves are full of human rights violations, right? Known human rights violations, rancid food, one of the ones that's been reported on, violence, and in many cases, and especially for children, we've seen recently, lack of access to medical care can result in death. Detention results in removal from social support networks, meaning you just aren't able to access the people who keep you healthy. And for some, though not all, being deported can return you to a site of violence in your country of birth. I like to pause here for a second because I don't want to cast Mexico and Central America, where we deport most folks from the US, as these countries full of violence, right? Many of us come from or have family who came from these countries, and they are not countries purely full of violence, right? Nonetheless, it merits being said that some folks do flee violence and are returned to violence in which they may be killed in their countries of birth. Removal also has results for those who are attached to us, right? Attached to the removed individual. Because of the nature of immigrant work, because it's often involving manual labor, it tends to be very gendered, with men doing much of the work. What this often means is when the husband is removed, it can result in acute poverty in the house when the breadwinner or the financial provider is taken away. Joanna Drebi, who's a sociologist at the University of Albany, I'd recommend everyone reading her work, describes this as suddenly single motherhood, in which two-parent households experience the detention and removal of a father, removal of a primary breadwinner, and removal of a parent, and the rest of the family overnight is left to adapt. This can also lead to the dissolution of the family, or to put a different way, actually a way I prefer better since I originally put this on the slide, certainly a rearrangement of the family, right? I don't want to say that all families are dissolved upon deportation, because it isn't true. Families continue even across borders. They always have and they always will. But nonetheless, the removal and the change of that emotional relationship with your parent is inevitable, and it is worth thinking about. So detention and deportation, actual detention and deportation, can harm our health and those of our social network, but it can also create physiological changes when we're worried about the potential for deportation. This can activate our fight or flight response, right? What do? I'm scared. I get this rush of energy. For example, during a traffic stop in which you're worried about being pulled, in which you're pulled over and being worried about being detained. Frequent activation of this physiological system creates wear and tear in multiple biological systems, right? Put another way, we just can't have our adrenal glands going off all day, all the time. We know that this chronic activation can result in hypertension, sleep difficulties, and weight changes, many of which are critically important, especially during pregnancy. And lastly, when we're worried about the possibility of deportation, when we're worried about the surveillance and possibility of apprehension in our lives, sometimes we change our behaviors. We may confine ourselves to our homes because there's no way to be pulled over when we're inside the house. And as you can imagine, there's multiple repercussions of being unwilling to leave the house. For one, we avoid social services. We may not go to clinics, we may not go to hospitals, One, because we don't want to drive, and two, because undocumented folks may not want to be asked for their ID, asked for a driver's license. And this may also result in the avoidance of certain areas or even certain people. Lots of what we see in our work is communities describing, well, that area, there's a lot of police. That area, ICE was pretty active in that area recently. Or worse, ICE was after that person. We sense they're after others in that person's family. We're not going to associate with them, hang around with them. This leads to two obvious extensions, right? If we avoid certain areas in which our grocery stores and our hospitals and our farmers markets exist, we lose that option to stay healthy. And if we avoid certain people because we're worried about the opportunity for them or us to be detained, that shrinks the social safety network of that individual, the social support network of that individual and us as well. So we think about all these are the three pathways I think of in public health to describe how fear of enforcement can impact your life. But what does this have to do with vaccine equity, right? Does this have anything to do with when and how people get vaccines? What did it change during the COVID-19 pandemic, or rather, how did it impact the outcomes of the pandemic? Now, many of you probably have direct experience with an answer to this question. You serve the immigrant community. You spoke with people who may engage in any of the pathways I've described. Perhaps you didn't have that or use those same words, and hopefully I've provided something that can help talk about what you're encountering with other folks. But let's think a little bit about how these pathways may have shaped vaccine equity. So we'll go with the first pathway, right? Actual detention and deportation. And as many of you know, the highest proportion of deaths, the highest number of deaths at the beginning of the pandemic were in prison. As I mentioned before, prison is simply not made for people to be healthy. It's made to pack people closely together. It's made to pack people of color into a small space in which they can be surveilled, right? This is absolutely something we should reckon with in our practices of public health. And what happens in small enclosed spaces without access to hygiene? Infectious disease can run rampant, and that's exactly what we saw at the beginning of the pandemic. A dear friend of mine, Alejandro, was detained at the beginning of the pandemic. And he was born in Costa Rica, but had lived in the US about 15 years at the time of his arrest. And when he was detained, rather than fight his case, this was at the beginning again of the pandemic, he decided, oh, I think I am going to, the phrase is self-deport, a phrase that I do not like, because no one self-deports. They opt for one of the possible options, for the least worst option, but nonetheless, to use the terminology, he chose to self-deport rather than stay incarcerated, rather than stay, in jail at the beginning of the pandemic. And part of what we were reckoning with in deciding whether or not to contact a lawyer was just what you can see here. And the line, the red line is a little off, but we see the cases in Costa Rica at the time and the deaths, 950 deaths, right? And we compare this to when Alejandro was in jail to 1,100 deaths just in the prison system, right? What was happening is, for many folks who are detained, they were debating between less cases in their countries of birth and cases in the actual prison system, right? A higher per capita rate here in their countries of birth. Now, this is tragic on many levels, but one of them is that if you think about how where we live, work, and play may shape our health, when the space in which we live, work, and play is the prison system, is the detention system, there's only so many things we can do to maintain our health. And this shapes our decisions to access lawyers and fight our deportations. I'll go with the second pathway as well. Pathway 2 is behavior change, right? Worrying about the threat of deportation. So this is me and my dad. And, as I was going through looking for these pictures, I thought about the beginning of the pandemic, and those original days of the vaccine were emotionally charged. I remember being excited with my father, who was of the age that he was able to access it early. And here we are at Eastern Michigan University, which Dr. Brown, I'm sure you recognize. But this is a big facility, right? It's a large facility with vast windows. It's kind of like an airport. Lots of cement, lots of security. For me, it was daunting, but I felt safe there, right? I was able to access that space, and I felt safe. But we'll ask ourselves, what do spaces like this represent? Often they represent very formal healthcare systems. And let's think about how immigration enforcement may impact our view of the healthcare system. I want to take you back to a woman who I call Guadalupe, who's was and is and continues to be a very dear friend. And this was a conversation that she had with me right after the immigration home raid that I talked about and separated, right? So I want to read this to you and invite you to think about how this may shape her willingness to access a space like EMU. So I told her, so we were talking about police cars and the fear that comes from seeing a police car. The word is patrulla, which means a patrol car, but it's also this catch-all word for ICE vehicles, police cars, sheriff's vehicles. It doesn't really matter, right? These are the vehicles that may detain and deport you. So I asked her, you were talking about how frightened you were from las patrullas. Do you feel the same fear when you go to a clinic or a government office? She says no. So I asked her, why not? She says, I don't know. Maybe it's because in clinics and such, I've received that help before. In my mind, it's the police. It's the police who are the ones who took the father of my daughters, the ones who took away my brother. They're the ones who took my family, who, if they detained me, would separate me from my kids. Now, at this moment, as I'm talking to Guadalupe, I was a younger researcher, and I thought this was all that she was going to say. And you could tell this was one of the first times she had articulated this, right? So I could see her working through her thoughts. So when we pause here, she continued a little bit. There's a moment of silence, and then I refined it, and she kind of changed her answer a little bit. And I asked her, do you use services in Washtenaw County, our county? She says, yes, I have the Washtenaw Health Plan, an insurance program for everyone. And you used this before the raid too? I asked her, and she confirmed, yes, I did. So I confirmed again, okay, so you used the same services before the raid as you did after. And she said, I asked when I went to renew my health plan because of the raid if there would be any problems, because they had my name and all that, but they told me no, I shouldn't worry, nothing will happen. So the young researcher that I was thought he stumbled upon the key finding here, right? So I confirmed it with her. And I said, okay, so you have confidence in the person who discussed this with you, right? Perhaps that's what we're finding. If you know and trust the person you're discussing this with, perhaps you'll access these services. And she said, well, yes, because I thought they know more about this than I do. She told me that all the information was confidential, but if I wanted to share more, I'd have to sign for it. We pause again, and it turns out she wasn't really done there either. And Guadalupe continued, she told me the truth is that in that moment, when they told me that my name would remain confidential, I thought it was a lie, and I was scared. I had the address of a friend who was a white US citizen, and I used that address so that my bills would go there. I didn't want to give my address. Where I was, nothing. And I asked her, so immediately after the raid, you didn't want to share your address, not with your insurer, the Washtenaw Health Plan, who you trusted, not with anyone? And she confirmed, no, nothing like that. I didn't want to share my information with anyone, including food stamps for the kids. I didn't want to renew anything because I was so scared of everything. So Guadalupe had taken me kind of on this trip, this meandering thought process that she was working through herself. Yes, I trusted people. Yes, I trusted people with the experience. Yes, I trusted people, though she didn't distinguish it here, who spoke Spanish to me, who understood about my immigration status. But then she ended with, when there's something as intense as this immigration enforcement that took numerous people from my family, I didn't trust anybody, right? So returning to that example of EMU, I wouldn't necessarily expect somebody like Guadalupe to walk in to this facility, right? This large stone facility, again, successfully vaccinated hundreds, if not thousands of people in our communities, but that doesn't mean everybody would go. What Guadalupe is doing right now is changing her behavior to avoid the possibility of deportation. Now, I really like to share this story because I'm actually quite happy with how it ends. You see us here at a different vaccine clinic, right? And so this is a local church, one in which my family and I at the time attended, and one in which had a different vaccine clinic. And again, if you remember back to that moment, there was a lot of emotion attached to the vaccine. And my partner had volunteered, and I knew she'd be able to receive the vaccine had she volunteered. So we were very excited about this. And so she walks into this small church in this small gym, which you can kind of see here on the right. And who does she see there? She sees Guadalupe, who's volunteering at the church and volunteering to help give vaccines to all of the members of our community who generally spoke Spanish, were undocumented, and kind of didn't want to go to EMU, right? And I want to be, again, clear, because I think this is important. I'm very happy that EMU did what it did, but nonetheless, there are behavior changes for certain individuals given the type of space that it was. So Guadalupe comes here, offers to translate, volunteers, gets her vaccine, and also facilitates other people getting her vaccine. Now, I like this example because it's easy to cast people in these particular positions of oppression as powerless, right? As the victims of institutional injustice. And perhaps many times that may be part of the case, but they're also people full of agency and people who are creative and innovative and create and maintain and run and volunteer in other systems, right? And this is part of what, I want our takeaway to be, and I want us to remember, is that there are being aware of these pathways in which immigration can affect our health, in which the spaces in which we live, work, and play can impact the outcomes for those around us, for those in marginalized communities around us. There are roles that we can play, such as starting vaccine clinics or supporting vaccine clinics in spaces that may feel safer. They may not ask for a social security number or an ID and a record in the same way. So I'll end with a few takeaways. And the first is I'd like to remind folks that migration is beautiful. It's a part of human history. It will always happen. It has always happened. And immigration laws are a matter of public policy, right? So as quickly as we can point the finger at someone for breaking the law, we can change the law so that they will no longer be breaking it. And that is part of what we need to understand when we think about not only immigration policy, but many of the other behaviors we criminalize, which impact our health. Immigration enforcement, just like policing, just like the incarceration system, drastically shapes where we live, work, and play. Some of us may not consider this because we're not targeted by these systems. We're not impacted by these systems in the same way. But for many folks, it shapes 365 days of their lives. We probably have influence over some aspect of immigration enforcement, right? Some aspect, no matter how small or no matter how large. Do you ask for a license for folks who come into your facility? Because you don't have to. You may be meaning to say, do you have a photo ID? And that simple change in language can really destigmatize folks in states in which they don't have access to driver's licenses. You also vote for a sheriff who may or may not collaborate with ICE, right? These are important things to consider. Now, remember, behavior change can be good. For as much as we make behavior changes to protect ourselves from these terrible health outcomes, detrimental health outcomes, behavior changes are made for all sorts of reasons, including accessing a clinic that is nearby, in which there's parking, in which folks speak Spanish, right? In public health, in your work, we make the best choice, the easiest choice. We facilitate those choices. Lastly, I encourage folks to continue to educate yourself. There is no bad starting point in this discussion. If you had to look up what deportation meant, or if you're actively advocating for driver's licenses, right? I don't care where on that spectrum you're starting, every gesture is important. And lastly, and one that I didn't list here, immigration enforcement is just one example of how the social determinants of health can shape health outcomes and shape our lives. I encourage you to think of other policies that do the same, and specifically how those had impacts during COVID-19 and in vaccine equity. So I'll stop there. I want to briefly shout out to the two artists, Dalia Harris and Carolina Jones, who engaged in this project with us. They read our interviews with 76 people throughout the country who described their experiences of immigration raids. They looked up all the articles they could on the media, and they painted the images, or they drew the images based on those discussions and interviews. So thanks to them both. I'm also happy to continue the discussion over email and Twitter, and happy Pride Month to those who celebrate.
Thank you for that wonderful presentation, Bill. Now, we'd like to open up the space for the Q&A portion. So feel free to send any questions in the chat, or feel free to unmute yourself as well. And while we wait, I can get started with my question. So in thinking about the differences across states in immigration policies, especially those around enforcement, what role does geography play in the impacts that come from enforcement, and how does it vary? So for example, I'm thinking differences between like sanctuary states or cities, border towns, or states with anti-immigrant policies. Like those that don't offer driver's licenses to immigrants?
Yeah, thanks for a great question, Luis. A couple things that I think about in this case, right? What's the difference, or what's the role in different immigration enforcement and rhetoric from one state to the other? And one is that folks are often making health decisions based on a gut reaction, right? They're not always making them based on clear statistical evidence of what the likely outcome is. And even when you do, something like deportation, however slight the odds may be, is a fairly catastrophic outcome for most folks, right? So it's really important that no matter what state you're in, that national rhetoric really influences whether people get that gut reaction that, like, if I go there, it may not turn out well. If I go there, well, the president hasn't said anything bad. Maybe it'll be okay, right? So what we talk about is really important because that's how people make their general everyday health decisions. But there is concrete differences from one state to the next: states that support undocumented students in universities, states that provide financial aid, and certainly states with driver's licenses, right? And I continue to bring up driver's licenses because in Michigan, we don't have access to driver's licenses for folks without social security numbers, and other states, they do. And this creates huge differences in access to resources. I usually have my students list when they'd use their driver's licenses, of course, to drive, but what else? Picking up prescriptions. There you go. Slightly mind. Picking up prescriptions, right? Picking up our kids and going to field trips with them. We use them to for many rent, bank account, library cards, right? Lots of things, right? So these are kind of concrete ways that impact our access to health preserving resources. And I see a question from Lance here. Are you doing any research on what happens to immigrants who are bussed down on false pretenses out of Texas to DC, Massachusetts, or California? That's a great question. So no, and part of what happens with research is that it's usually a little slow and behind where the state of advocacy is and where the, frankly, like news is, right? Where what's going on in the world, in our country, often the research is a little bit behind it. If I were, to guess how this plays out, for one, right, there's need in these communities, and often the amount of the ability to provide for those needs is based on the people who have the need, right? Put another way, when you're moved from a big state like my home state of Texas to a smaller state, it's very unlikely that you're not going to have the infrastructure in place to take care of everyone there, right? And I think one of the most important parts here is what happens when folks are bused and then are not allowed to access resources. And what happens is the political rhetoric is often exactly what the politician wants, right? So there's lots of Latino immigrants who therefore don't have things like food or access to healthcare system, or perhaps even something like clean clothes, right? And I hate the words that I'm about to say. I think they're important for the topic here, but the language we've always used, the language that's always been used to speak harm against immigrants has been things like pests, right? And phrases like invasion and words like dirty. Again, not my words, the words that have been used in the past. And when folks are bused to these places in which resources aren't available, when folks are held at the border, it gives politicians this fuel to continue with this rhetoric and to continue stigmatizing these communities, right? So there's not only the very literal, some people will do worse, there's also politicians who are anti-immigrant use this to increase their electability based on their anti-immigrant rhetoric.
I see another question in the chat from Lizzie. I can go ahead and read it. So it says, how can we effectively advocate for the right to health to leverage access to care and social services in the midst of these political determinants of health?
Great, thanks, Leslie. That's a great question. Bringing in political determinants of health after quoting the WHO. I'm curious as to your public health background there. It's a great question. For one, I think there's a couple of things you can think about. We think of immigration as a federal policy and a federal issue, and it largely is, right? So the president decides how ICE, Immigration and Customs Enforcement, and DHS, Department of Homeland Security, are going to arrest, detain, and deport people. So it's hugely influenced by federal decisions, but it's also really influenced on the local level. Driver's licenses, of course, tuition for in-state students, of course. So there's this balance that we can find between working on the local level, electing our sheriffs. And I bring this one up because often folks don't realize Sheriffs control the jails control who is detained, and jails control whose information is sent to ICE, right? So we can advocate on these smaller levels, make decisions based on our local policies, and find avenues to advocate on the larger level at the same time. I will say that the language of health tends to be language that folks can be more receptive to. There's the language I'm looking for. So often when I'm talking to my public health students, right, I remind students that we in public health do research against, or rather research that shows the harms of institutional racism, of structural racism, right? We know when we speak out against racism, we do it based on empirical evidence, right? It's part of our mission is to address these systems of racial inequality, but not every politician and not every business has addressed systems of inequality in their charge. I always remind folks, like, they're going for electability and they're going for profits and they're going for a lot of other things besides health equity. So what that means often is that we have to find common ground, and often, I think, lucky for us, health is that common ground, right? We're able to talk about health in a way that we're not often able to talk about other of our ideals in all these spaces. I'm going to go back to the driver's license example because it's important and fresh in my head. But driver's license certainly is about the right to have an identity validated by an institution, as well as the resources that it comes with, of course, but also everybody benefits from drivers having insurance, right? So undocumented folks with visas, citizens, all benefit from everyone in the road having insurance, right? So this is a health argument that we can make to all sides of the political spectrum.
I see a couple more questions coming in, so I'll go ahead and read them out to you, Bill.
Sure.
So Andrea asked, on the note of geography, Florida's new law will require all hospitals to accept Medicaid to collect and submit data to state on, sorry, this one keeps popping up, to state on cost of, okay, I'll just start all over. My chat like kept closing. Florida's new law will require all hospitals to accept Medicaid to collect and submit data to state on cost of providing care to people without current visas. Clinics in general are already reporting cancellations of appointments. I guess it was more of a comment, talking on the variations of different state policies, especially
Sure.
those in Florida.
Mm-hmm. No, I can respond to that. That's a great question or comment, Andrea. It also speaks to one of the things that we often neglect in our health or health related work, right? Is that a lot of what we do in health is surveil, and for a lot of us, surveillance makes us uncomfortable. It's also an essential part of understanding disease spread patterns, right? So it's really worth considering, like, what are the political implications of the surveillance that we do? Who has access to that data, and what is the kind of data that we need to collect? One of the examples I often bring up is a few years ago when we were debating the census and we were debating what to have on the next iteration of the census during the Trump administration. And there was folks from the undocumented community and mixed status communities who were saying, we don't want to have that on the census. And there were folks in the LGBTQ community who were saying, oh, we want to talk about and list our identities on the census, right? And we think about, why would two statistical minority groups, in terms of how many people there are in each group compared to the US, why would two groups have these different responses, right? And it's because what matters when you disclose a particular identity is what is the reception you're going to get and what are the institutional resources attached to it, right? And so at the time, although I would certainly say, especially when Andrea brings up Florida, at the time, the reception towards LGBTQ communities was different. There was more of this reception of welcoming and affirming care, and the undocumented community also knew exactly what government resources were directed at it, right? And that is the detention and deportation. So going back to the point, when we're asking folks to disclose particular aspects of health and identity, there are many health reasons, including epidemiological reasons, that we do this. We have to consider the political implications and who it marginalizes. Andrea, I don't doubt that clinics are reporting cancellations or appointments. We saw that frequently during the Trump administration here, and actually in Detroit, when there were changes to the public charge, when there was debate about the public charge law, right? So it's worth considering how that's going to play out in Florida and how health is going to be different between Florida and states around it, because where folks live, work, and play is fundamentally different across these state borders.
On the note of political implications, there's another question in the chat asking about some of the HHS and bridge vaccine access programs. So it says that for those uninsured, once the vaccine is fully commercialized, what impact will this have on vaccine access for immigrants?
Yeah, Reba, that's such a good question, right? To think about what happens when we charge for healthcare, right? I think it's a good question that makes us reflect on our healthcare system. I always encourage folks to think about, while the topic at hand right now is undocumented status, what does it do for folks who are simply low income, folks who are unhoused, or folks who are exiting the prison system, right? So this decision to make things commercial and to charge has health implications for folks. What will I mean? I think it's very concretely that if you're charged for the vaccine, fewer people will get it if they don't have the means to do so. Absolutely. We're reminded also that for undocumented folks, the Affordable Care Act, which provided healthcare to millions and millions of people, for undocumented folks, they didn't have the option of opting into the pool. So they're often paying out of pocket as it was, right? So this does speak to this need to have more publicly funded healthcare, both for individuals, right, and communities who may need that to support their health, but also for, as we saw during the pandemic isn't stopping when you cough because someone paid a different way for their vaccine, right? So it is a matter of taking care of our whole community. Lyndon asks a question that we hear a lot, right? How do you respond to those who say there's a right way to immigrate and a wrong way to immigrate, right? You hear that often. And one of the things that I always think about is that only particular topics that I talk about is there this type of response in which people are kind of trying to maneuver out of a way to say, like, I don't want to provide healthcare to that group of people, right? So you never hear the right and the wrong way to get cancer, right? You just hear this when we're talking about things like immigration. Other health outcomes, we're just here to learn about how this outcome happens, how where you live, work, and play may lead to it, right? So usually when I hear those questions, I do talk about, like, first and foremost, my goal is to provide care to all people. My goal aligns with the goal of public health, which is to care about health equity, right? Not simply equality, not just that everybody's healthy, but that those who are marginalized and left out of our systems also have access. And I am going to put my attention there, right? And the right or the wrong way, legal or not legal, like, that is irrelevant in my provision of care. And then I also like to point out that laws are made by human beings, and as quickly as there's a right way and a wrong way, those right and wrong ways can be changed, right? We saw this with all sorts of laws. Women could not vote. People were enslaved, right? Escaping slavery was wrong and illegal at times, right? But we knew that. We worked and eventually have changed each of those laws, and we can do the same thing regarding immigration and undocumented status.
Thank you for that great answer. I have one more question, and again, feel free to continue sending questions in the chat. But in talking about the different levels of immigration, how might impacts of immigration enforcement vary across different family structures? So you mentioned the impacts of family units as a whole and what happens when the breadwinner is deported. But in your research, did you run into any nuances with mixed status families or families that have different immigration statuses across siblings or other family members?
Yeah, I don't see that in the chat, so I can't thank you by name for asking that question, but it's a good one, right? And so you heard me mention earlier that it's primarily fathers and husbands who are deported. So while that is, again, statistically true, I do like to explain why, right? One of the reasons is because of the type of work that undocumented folks are able to access is often manual labor, right? So in our community, it's taking care of yards is very common. Shoveling snow is very common, and roofing is very common here in the north. In other places, it's factory work. There's construction work, right? Physically demanding. Another reason this happens, that men are most likely to work, is because families are pooling risk. So especially in families of two undocumented individuals, it's a little less risky to have one person outside of the house and one person inside. And so often another person will stay at home and care for family and kids at home, and that's often the mother. So I don't want to say that there's always this gender dynamic, but I do want to say that there's very concrete structural forces at play that force folks who are men often to do certain type of work and not women. This itself is worth thinking about, right? Can men and women engage in different types of work? What is the system in which folks are able to engage in work beyond the confines of what is gendered for them? It also means I tend to talk about biological families, biological children, which again is the majority and is common and is the folks that I interviewed, but it's not the only type of family, right? So we think of blood family, but we also think of chosen family. We think of families with no kids. We think of queer and same-sex families. And we also think about families that are not just biological in one unit, but also across borders, whether that's state borders or across country borders, right? So there's many different types of families. The work that we do, I'll wrap up because I see there's another couple of questions. The work that we do or the framing that I use is actually a mixed status community. So we started thinking about these as undocumented individuals, right? And we even said undocumented communities. Those of you from places, I think of my home state of Texas, other folks know there's no such thing as an undocumented community, right? There's no group of purely undocumented individuals. Folks live with folks with visas and citizens and both in families and communities, right? So the reality is that many are mixed status communities and that the removal of an individual can often sometimes be someone you don't know. So it's maybe a cousin you never met or even a cashier that you never met, and that can still shape movement lights, Luis. It can still shape. Sometimes it throws me. Yeah, what was I saying? So yes, even the removal of people you don't know can still shape what you do, right? It can still shape and change your behaviors. All this to say your question was a good one. There's many different types of families. Removal does impact these families differently. A couple of things to think about is the source of income changed? Is there an emotional impact of the removal of this person? It differs whether it's your brother or mother or the cashier, both important, both different impacts. And there was a third one, which because Luis's light went out, I got distracted and don't have it lined up. So I'm going to stop there and go with a couple of other questions.
All right, I think we can combine these next two.
Sure.
I think in kind of where do we go from here moving forward? What programs are being implemented to help immigrants and improve the healthcare system? And kind of adding on to that, what resources doing this advocacy work can you share?
Sure. What programs are being implemented to help immigrants improve their healthcare system? Yeah, that's a great question, Levi. And part of what I encourage folks to think about is that since health is not the healthcare system alone, there are the levers we can pull in the healthcare system, but there's also lots that we do outside that is related to health, but maybe not necessarily the healthcare system. And often for patients and clients and folks in our communities, they don't necessarily disentangle those two, right? So working against a particularly harmful policy, they may see as just a big part of advocacy that also goes with changing hospital policy, right? So I may focus on one, a community I work with may be rotating in and out of different ones, and I try to be able to react to each of those quickly. I say that because sometimes there's not very much going on to impact the healthcare system, right? That just isn't where the battle is primarily being fought. Sometimes it's somewhere else. Right now, the battle is largely being fought, I would say, on the border, first for Title 42, regarding keeping folks in Mexico during the pandemic, and now also keeping folks in shelters. And prior to that, it was largely fought around child separation, all appropriately so, but all taking the conversation away from the healthcare structure, right? So part of our role is actually to say, part of our role is actually to say that this is still important, the healthcare system is still important despite what's going on at the border, despite Title 42 going on. I want to be able to add a little bit more concrete answer to that question. What I see in the research and, for folks certainly doing this work, it is really important to still continue to educate people. Folks don't see deportation as impacting the health of folks in their community, which to anybody who either comes from this community, works in it, or has done this research, it's self-evident that it impacts your health. So lots of education is still certainly needed. And then thinking about resources that advocate for this kind of work. Again, one of the things that I notice is that while we or I often think about immigration related work, often advocacy organizations are working to address the systems, one of which may be the immigration system, but addressing multiple systems at the same time. So for some, this might be abolition type work. For some, this might be anti-prison work or anti-racist work, right? Where they're addressing deportation is just one of the issues that they're addressing. So, as for organizations and advocacy that work directly toward immigrant health, there are certainly some. I also, encourage you to recommend or encourage you to look up organizations that are advocating for thinking about this systemically. I'm going to continue to go with driver's license organizations right now are kind of on the forefront of this in Michigan and other states in this position. So you can begin by looking up what those organizations are doing in those particular states. And then thinking about other grassroots organizations. One of the things that's also happened is now that deportation isn't at the forefront of this conversation, the advocacy tends to change and does at the forefront as much either, right? So we do see different advocacy organizations taking the lead, lots of which are in Texas and California. Thank you, Alicia or Alicia, and I encourage folks also, if you have recommendations, please share them in the chat. I'm often not the best at answering these questions because I don't know what current organizations they are. You all probably know better than me, so please share.
All right, well, thank you, Bill, for those great answers and for continuing this insightful discussion. I would like to save a few minutes to go through some announcements. So while I pull up that presentation again, I'll give a few more seconds for any last minute questions in the chat or if someone wants to unmute.
I also want to take a moment and thank you for the translation, because I was conscious of it a few times and slowed down for our translator. But I know that can be frustrating when folks are speaking pretty quickly and it's being translated. So I apologize when I did, and thank you for the work.
All right. The last question I see is asking about the presentation in PowerPoint. Yes, we will send that out at the end, either tomorrow or the next day. But with that, I'll just quickly go through some upcoming event announcements while we launch our satisfaction poll. So this Friday, from 11 a.m. to 12, we have our Pathways to Population Health Equity webinar. And then next week, we have 2 events scheduled. One is Tools and Tactics to Meet Your Social Media Goals. That'll be on Wednesday, June 28th from 3:30 to 4:30. And then the next day, on Thursday, June 29th from 12 to 1, we'll have our conversations on vaccine equity after the end of the PHE discussion session, which is a continuing session from one that we had last month. I think that's all. I think the satisfaction poll is already launched. But thank you all for joining our webinar today. And oh, there it is. And a huge thank you to Dr. Lopez for his engaging and informative presentation. We hope to see you all at our upcoming events, and thank you for continuing to participate in our webinar.
Thank you.
Thank you so much.